And I'll be speaking to you for the WMPHA side of things because I serve as the vice president for that organization right now. And I am also the director of public health in Montague, in case you didn't know. All right, do we have the slides up yet? I'm sorry. We do? All right.
I'll have them up now.
Thank you. All right, so here's just a brief outline. So we're going to start and just kind of talk about why air quality matters, give some information about the current health data that's available, talk about extreme heat, what we've learned from the data that already exists in the Healthy Air Network, and give some more information about how sensors can be deployed to that network or also outside of the Healthy Air Network for those of you who are in areas that might not be able to join the Healthy Air Network. Next slide, please. Thank you. So the reason why we're having this this presentation today is that the Healthy Air Network provides live air quality data directly to families across the valley. So it's a project that started out in Western Mass, but has expanded to the rest of Massachusetts, so that community residents can be informed with the decisions on how they spend their day. Together, we can use the air network to support collective efforts in policy and environmental projects to ensure that we all have access to healthy air. We are led by a group of community resident advisors who provide guidance to ensure that the process, actions, and outcomes will be informed by the voices of community members most impacted by poor air quality. And my involvement was that I previously worked in Holyoke, so I had an opportunity to be part of the Healthy Air Network as a health agent there. And now that I'm in Montague, I have had the wonderful opportunity to acquire some of the sensors that were offered through the DEP grant program, so I can speak a little bit to what that's like if anybody has any questions later.
So I'll take on. Hi, everyone. My name is Francesca Bermudez. I'm the program coordinator for Healthy Air Network, which we will get into. And so before we start, I just want to play a video clip from some of our resident advisors and community leaders that's a part of this collaborative project. Let me know if you're able to hear.
We are the Healthy Air Network, and of course, we advocate for healthy air for everyone.
We are the Healthy Air Network, and of course, we check the air quality daily.
We are Healthy Air Network.
Of course, we do demonstrations.
We are the Healthy Air Network, and of course, we teach kids how to build their own air filter.
We're from the Healthy Air Network. Of course, we're going to ask you to put an air sensor on your building.
We are the Healthy Air Network, and we use every chance possible to talk about air pollution.
We're the Healthy Air Network. Of course, we tell you the worst time of day for air quality.
We're from the Healthy Air Network. Of course, we know trees clean the air.
We're a Healthy Air Network. Of course, we care about the air you breathe.
We are the Healthy Air Network. Please plant a tree today.
We are the Healthy Air Network, and of course, we care about healthy air.
So Billy and Sarita, my colleagues, were on the video. You'll hear from them soon. But basically, the Healthy Air Network is a collaborative project between community residents in Springfield, Holyoke, and Westfield, and with other community-based organizations up and down the valley, public health professionals, et cetera, that we're really focused on air quality in the region, and with this belief in mind that everyone has the right to healthy air and a safe environment, but also everyone has the right to know about it. So our network project is a network of various air sensors around the up and down the valley measuring air quality. And the reason why we do this work is related to its connections between air quality and health. So we know that short-term exposure to air pollution and poor air quality can lead to respiratory infections. If you have asthma, it can trigger asthma, and asthma triggers and asthma attacks. But even if you don't have asthma, long-term exposure to it can lead to you developing other respiratory illnesses, lung cancer, and even premature death due to these. So knowing that those impacts, the reason one of our sensors measure PM 2.5, which are particles really, really small that can get into your airways and irritate lung function. And so just to give you an idea of how small these particles are, they're smaller than a grain of beach sand, smaller than the human hair, for example. So this is what our sensors are measuring. And, you know, like I mentioned, whether you yourself have asthma, whether, um, you know, if you are part of these vulnerable populations, such as children, pregnant people, older adults, people with heart disease, lung disease, or you work outside a lot, um, poor air quality affects everyone. These sensitive groups are just more prone to getting more irritated, getting more, you know, feeling the impacts more. But if everyone's exposed to poor air quality, we're all affected, not just the vulnerable populations. And so now I'm going to pass it on to my colleague Sarita. They'll go into more of the connection between air quality and asthma and what our work entails.
So hi, everyone. Sarita Hudson. I'm Senior Director of Strategy and Development at the Public Health Institute, and I've been leading the Asthma Coalition out here for over 10 years. And one of the things we know, it's October now, but we just came off the September asthma peak. And so asthma flares up in the fall. It's from the pollen, it's from respiratory infections as kids and everybody's back to school, back inside, and just all of the heat that continues. So we know that we see this uptick in asthma impacts. Next slide, please. So the reason that we started looking at air quality is because of the high asthma prevalence in our region. So if you look everywhere that you see that that red triangle, that is statistically significant higher asthma prevalence. This is for school age kids. And you can see that, you know, Springfield, Holyoke, and South Hadley are red, and then up in Sunderland as well is showing up there. If you go to the next slide, we're going to hone in on Western Mass, and that gives you a better sense of where you can see the higher rates. So this is around school age asthma. Here's a chart that really shows you the prevalence, and you can see South Hadley and Sunderland are making it up into the Chicopee, Springfield, Holyoke that have been kind of the hot spots for asthma. I think Springfield area was the #1 asthma capital based on the Asthma and Allergy Foundation of America in 2018 and 2019. And then we went down to 12, then we went down to 46, and now we're back up in the top 10 at #4. So we know that asthma continues to be an ongoing problem. Next slide, please. The other thing that we wanted to look at when we're doing this work is we're thinking about environmental justice communities. And environmental justice communities are those communities where we know that there's more industrial sites, where you have highways going through neighborhoods. And so these are where we might expect to see lower air quality. In addition, the state of Massachusetts has an environmental justice community definition. It's based on communities of color, low income, language isolation. So that means people who don't speak English. And so if you look at this, you can see this map really shows you where we have most of our vulnerable folks. And certainly in the Franklin County and Western Mass, we have a lot of folks, in addition to those folks down in where we are in Hampden County. So when we talk about that asthma capital rates, it's really, they're talking about the whole Connecticut River Valley. A lot of that data is from Hampden County. Some of it is from Hampden, Hampshire, and Franklin County as well. So this is why we are working in this region, because we know of the vulnerabilities for these communities and the health disparities as well. Next slide. I think I'm going to turn it over to Billy.
Yep. So hi, I'm Billy Spitzer from the Hitchcock Center for the Environment in Amherst, and we are working with Sarita and Public Health Institute and her team to expand the network more into Hampshire and Franklin County, and also to, as part of that, incorporate more rural areas, and also the effects of heat and how it relates to air quality, as I'll talk about later. Also more education and community and youth engagement. So I'm going to talk a little bit first about the connection between climate change and heat and air quality. And, we're all seeing an increase in extreme weather events, whether it be hurricanes or heat waves, flooding, droughts, wildfires, etc. Next slide, please. And, one of the ways we see that is increased heat waves. And this is some data from Springfield, but we see this, throughout the region, that we're likely to have not only more days that are above 90 degrees, but more extended periods above 90 degrees where it doesn't cool off in between. And that is often related to poor air quality for a couple of reasons, as I'll show. Next slide, please. So yeah, it's particularly dangerous when you get multiple days of high heat. We can keep going. And then one of the things we see when you have these extended hot periods is an increase in ground level ozone, which is another pollutant in addition to the small particles that irritates the lungs, and happens when you have emissions from vehicles and factories that create nitrogen oxides and volatile organics. Those two things together cook in sunlight, and that creates ground level ozone. And that's one of the things that exacerbates the health problems that we see. Next slide, please. As I was saying, that you see that sort of catalytic effect of the heat on ozone production, and that's one of the things that can create essentially bad air days. Next slide, please. We see the impacts particularly in urban areas, but also extending into suburban and rural, and even some somewhat rural towns. For example, Athol is a good example that has kind of an urbanized downtown, and you can see more localized impacts of heat in those downtowns. Next slide, please. One of the things that's emerging is more attention on heat. The CDC came out with a heat tracker website. And if you search on the web for CDC and heat tracker, or CDC and heat risk, you'll see that they have a pretty good website for being able to plug in where you are, and what's happening in terms of current heat levels, what the danger is, what the risks are, what the recommended actions are, what the forecast is for the next few days, and also what the air quality is. So we're starting to see a better kind of broader communication effort around these issues. And OSHA is working on guidelines now for protecting workers in the case of extreme heat. So, in a good way, there's more attention on these issues, but there's still a lot of need for getting the data out there, getting the public communication happening, helping people understand what they can do to protect themselves, and their families and so on. Next slide, please. So one of the ways that we try to communicate, and agencies try to communicate air quality in a way that is kind of understandable across these different pollutants, whether it's particulates or ozone, is something called the Air Quality Index. And basically these different levels from green to yellow to orange to red and so on are a way of correlating concentrations of whether it's particulate matter or ozone to what are the health risks and what are the recommended actions. You have a color rating, you have a description, You have a number. These are all different ways of communicating, everything from, good air quality in the green category to moderate or unhealthy for sensitive groups to unhealthy for everyone, and so on. As you'll see on the next slide, this is how we share the data on the Healthy Air Network, so that each of those dots represents an air sensor, and you can click on one of the locations to see what's happening. And I don't know if you want to do that later, Sarita, do you think? Should we do that later when we talk about, yeah, we'll show you that later if you haven't seen it, and you can click on the live map and see what's going on. So we use that color scale to communicate what the air quality is like. Next slide, please. And as you can see, we've been expanding into Franklin County and so on. I wanted to spend a minute talking about, why should you join the Healthy Air Network? You can go out and get your own low-cost air sensors. I think many of you have or will receive sensors through the Mass DEP's grant program. And the purple air sensors, which are the ones that are really the most prevalent for measuring particulate matter, PM 2.5, are great. They're low cost. They're fairly easy to set up and use, but they are low cost. They are not necessarily accurate out of the box, when you look at data from these sensors on the Purple Air website, if it hasn't been corrected, it can be pretty far off from the actual values. And part of the reason is because these sensors are responsive to humidity as well as particulate levels. And if there's high humidity, the results can be pretty far off. And so there is a sort of standard correction that the EPA has developed that can be applied to these sensors to make them more accurate. But what we do in the Healthy Air Network is, in addition to that kind of standard correction, the folks at the Yale School of Public Health calibrate each sensor individually to account for any differences between sensors and make sure that the sensor is healthy. That is something that I think really adds value to the data, and especially if you're using it for public health guidance, you really want the data to be as accurate as possible. In addition, we make sure on the Healthy Air Network that we know where the sensors are actually placed. Someone can put a sensor up on the Purple Air site, and you don't necessarily know if it's where they said it was, or if it's indoors or outdoors. That's something that we track, and also we help to monitor and troubleshoot the health of these sensors to make sure they're continuing to work. And finally, I think one of the most important things is that we're really all about supporting community engagement and education, so that it's not simply about getting more data on the web or on the network. It's also about really helping communities understand what's happening with air quality, what they can do to protect themselves in the short term, what kind of mitigation measures they can undertake, and also how we can solve some of these longer term air quality problems. We really would encourage all of you, if you haven't already, to connect with us to get your sensors calibrated at no cost, and to be on the Healthy Air Network. Next slide, please. So just really quickly, why do we need all of these air sensors instead of just relying on the ones that are already out there, from the state, for example, that are the federal reference method monitoring stations? Those ones, like the ones you can see in this photo in the trailer, those are the most accurate. They are really expensive, and as a result, there are not that many of them, and they do a good job of kind of capturing patterns across the region. And on this slide, you just see the locations of the EPA reference monitors in New England. Next slide, please. But if you look at PM 2.5 on a much smaller scale, you can actually see a lot of variation. And this is based on a study from London, and you can see actually where the roads are by those areas of high particulate matter. And so, you can really get down with these low-cost sensors and get much higher resolution in terms of really understanding where are the problem areas, and where do you need to take action. Next slide, please. Real quickly, the way these sensors work is they have a small laser that shines across a stream of air coming into the sensor. When that laser hits particles, it reflects light back onto a detector, and then you can use that to measure the particle concentrations. Next slide, please. This next slide just shows how the calibration works. Is basically the Yale folks take the purple air sensors, bring them to one of these reference stations, and leave them out there for a few weeks to really be able to calibrate each individual sensor. And if you send your sensors down to Yale for calibration, this is exactly what's going to happen. And then on the back end of the website, they manage the calibration for each individual sensor. So the data that you see on Healthy Air reflects that individual calibration. Next slide, please. This just shows a little bit about how that calibration works. And you can see on the left-hand side that the difference between an uncorrected sensor and a calibrated sensor can be quite dramatic, especially when there's high humidity. So, even at low humidity, the difference between an uncorrected sensor and a corrected sensor could be almost a factor of 2, and it can be even larger than that when you're looking at high humidity conditions. So they use the equation on the bottom right to do that calibration to account for the humidity, as well as account for individual variation among the sensors. Take a deep breath. See if there are any immediate questions. And then if not, I'm going to go on to the next section and talk about kind of what we're learning from the data.
Billy, there are no questions in the chat yet, except whether people are going to get a recording and the copy of the slides, which I said they would.
Yep. And please, once you get a copy of the slides of the recording, you have more questions, please contact us and we'll be happy to help you out.
One other thing, I guess, just to say is that as I put in the chat, if you registered for this workshop by yesterday, you got information about how to get it calibrated and how to install it when it comes back as well.
Great. And we're happy to help with that if you have questions. I've already had a couple of folks contact me. And I would say if you know anyone else who's gotten sensors through the state program and they don't know about Healthy Air Network, please share the information with them. I've asked DEP for a list of all the grantees. I haven't gotten it yet. Hopefully they'll send it along so I can reach out, because we really would just want to help here. That's our only interest. So I want to talk a little bit about what we've learned from about 2 years of monitoring data now. And basically there's kind of 3 different things. One is the impact of vehicle traffic. The second is variations season to season. And the third is the impact of wildfires. Next slide, please. So this shows some data from Springfield. On the left-hand side is basically accumulated 1 year's worth of data from sensors in Springfield. First on the left side at midnight, and then on the right-hand side at rush hour. And you can see that at midnight, the air quality is pretty good, mostly in the green, a little bit in the yellow. And then you move into the rush hour and you start to see much worse air quality. And you can see that it's also not uniform everywhere. And one of the things we've started to do is try to identify where are the neighborhoods that are most impacted, how does that intersect with other social determinants of health and so on, and how can we think about policy changes that would improve the situation. Next slide, please. This next graph is just kind of diving into looking at that variation by time of day. You can see the morning rush hour peak, and then you can see lower particulate levels during the afternoon, and then coming back up for the afternoon rush hour. And you can see how that effect is really much more dramatic in the downtown areas versus the suburban areas. Next slide, please. And the data you're seeing here from Springfield is going to be similar to probably what you'll see in Greenfield and other places along the I-91 corridor, and probably also the Route 2 corridor, I would imagine. And so one of the things we can start to do as we get more sensor data out there is we can start to do these kind of analyses. What you also see is seasonal variation. And so you can see the impact here from 2 years of data of wildfires, and also of what's termed biomass burning, which basically is a catch-all that's going to refer to burning wood, burning any kind of fossil fuels. And you really see those peaks during winter, whereas you tend to see the wildfire peaks during the summer. And one of the things we're going to be working on is how do we talk about the impact of burning in communities where that is the primary source of fuel for heat and so on, particularly when we're talking about wood burning. So that's one of the things we're going to be working on doing, in partnership with the various communities that we're working with. We're not really going to try to go in and start telling people, no, you can't burn wood, but we want to help people understand what are the mitigation measures they can use to reduce the impacts. Next slide, please. This just is an example of showing, when we've seen high wildfire smoke, we've been able to use that to inform communities. I know Sarita was getting phone calls from Northampton about what to do. At the Hitchcock Center, we were using this data day to day to determine what kind of activities we could do in our summer camp. Really having this real-time localized data is very, very helpful if you're trying to make decisions about what to do in terms of behavior and so on. Next slide, please. I'm just going to show you a couple of examples of data from Franklin County, and this was pulled directly from the Healthy Air website. When you click on a given air sensor location, you can pull a history of the data, and you can set the time frame. So in this case, I was looking at June and July of 2023 in Greenfield to see if we could see the impact of wildfires and wildfire smoke. And you can see the impact of the Canadian wildfires in those red peaks during that time, where the air was getting to be unhealthy. And that was a time when you could see it, smell it, feel it, and so on. And then on the next slide, you can see another data poll from December of 2023 in Sunderland, where I was looking for, okay, it's cold weather. Can we see the impact of people using fossil fuels and wood for heat? And yep, you can see that the air is starting to become unhealthy during those times. And one of the issues that we have in our region is that air tends to settle in the valleys and tends to stick around, and that creates a concentration of these pollutants. So with that, I'm going to stop for a minute and see if there are any questions about either this data or data that you wish you had.
Hi, this is Phoebe Walker. Again, I'm here because as one of the things we do at the Franklin Regional Council of Governments is have the community health improvement plan for our region, and increasing local public health access to this data is one of our goals for the next 5 years. So that's why I'm here monitoring the chat. And I don't see anyone in here, but I do imagine that one question that would come up is on the map you showed, on the link to the map, why are sometimes some of them white? And what happens when they are white and not reporting data?
So he partly gave where the answer is. Sometimes we have data that sensors that are offline, that is something that like I feel like I'm learning about. Why does that happen? So it can be a combination of things. It can be everything from sometimes we've had a Wi-Fi password change. Maybe like, you know, like this, and this happened particularly, I think, during COVID, as like people left, they, you know, passwords got changed, no one knew, or no one knew what the password was. So if these sensors lose their Wi-Fi connection, that's a problem. That can also happen if sometimes there's just a bad Wi-Fi signal. I've also seen sensors that have been unplugged. I've seen, you know, GFCI circuits that have been tripped, you know, circuit breakers that have been switched off or triggered. And what we try to do is, as much as we can, keep on top of which sensors are reporting and not reporting, and contact the people involved and say, hey, can you go check what's going involved? I've personally visited a bunch of sensors that were offline and gotten them back offline, gotten them back online. Some of them have then gotten back offline, and you kind of have to go back around. But one of the things that we really hope to do when we're installing sensors is make sure that there is someone at the location who is interested and cares about air quality and is willing to kind of monitor the sensor. You know, I can tell you that the sensor at the Hitchcock Center, you know, we kind of look at it every day. It, you know, anytime we've had a problem, we get it back up and running right away. You know, I think that's one thing to think about when we're placing sensors, is, you know, place them at a place where, you know, people are interested in paying attention. But we're also happy to help troubleshoot. Yeah, I don't know if Sarita or Francesco, you found any other issues?
Yeah, no. One of the things is if there's a really weak Wi-Fi connection, sometimes it just keeps going offline and offline. And those are the ones where we'll probably choose to put it in another location, if possible. And so I think, and then we've had two different kinds of sensor, and some of them just the air use sensors, which we're phasing out. You all have purple air sensors. Some of those got damaged through rain.
Okay.
So for some of them, it is good to follow the recommendations around where to place them. So we'll have that. I think that's in this later.
Yep, that's later on
presentation.
in the deck.
So,
Yep.
Okay, thank you. We have a couple other questions now.
Yep, I
Um,
see them.
One
Yeah.
question directly to me was, how can we still get sensors? Another is, how much of what you're seeing is coming from stationary sources versus mobile sources, and how often do the sensors need to get calibrated?
Yep. So the stationary versus mobile sources is a really interesting question. I think, you know, we've talked with Crystal Powlett at Yale School of Public Health a little bit about, you know, what kind of analysis do you need to distinguish? I mean, there's some kind of almost like data forensics you need to do, and maybe some additional data that needs to be collected. I think that, yeah, I mean, you can obviously see from some of the time patterns and the spatial patterns where it's pretty obvious that you're looking at transportation impacts, for example. But yeah, that's a good question. We tried to put some monitors near where we think there are stationary sources. In one case, near a cemetery with a crematorium, to see if that has an impact. I don't know, Sarita, do you have other examples?
Yeah, I think that's where, you know, we have on our wish list of further research to do would be to do some tracking of VOCs of other emissions to see whether or not we could place it and connect it to a particular point source. But we don't, these purple air sensors will not do that. They're measuring PM 2.5. And I see there's a question about NOx and sulfur dioxide, and neither of those are tracked by these purple air sensors.
Thank you. And the question of how
often
do they need to go back to Yale? Yes.
Yeah, so I think we haven't, you know, I think the sensors are designed to, last several years at least. I don't know if we know exactly how long they last, because these are fairly new, at least in this kind of extent of application. I know that the Yale folks have a kind of a sensor health dashboard that they use to kind of monitor how sensors perform over time. And I think if they see a sensor start to drift, they would flag it to be recalibrated. The other thing is that each sensor within it has two individual laser sensors. So sometimes you'll see, what you want to see is those two kind of in lockstep that are correlated with one another, but sometimes you'll see one of them start to be off, and that's often a sign that it could be that the sensor isn't calibrated, but often it turns out to be something like a spider has now inhabited the sensor and built a web, and it's just causing interference. But I think probably my guess would be, every few years you'd want to check and make sure the sensors are in good shape. And I think one of the things that Yale does also is looks at a given sensor relative to its neighbors. So if you see one that's kind of off the reservation, that tells you something. But that's a great question. I know they're willing to recalibrate them whenever is needed.
Okay. And your final question so far is it still possible to get a sensor if you missed the DEP grant?
Well, this is the, if we go on to the next, do we have I
Okay.
can tell you, yes, there's another slide coming up about that. So,
All right. Hang tight, Heather.
so.
All right, so
let's-
I think it's back to you, Sarita.
Yeah, so we have what you can do. Here's some information that we have around. This is what we're looking to support and work with you all on, is the monitoring the air quality, getting guidance. We'd love to get the guidance out around the days with poor air quality, extreme heat, and we're doing more and more in creating these kinds of materials. We've also working with Billy's team at the Hitchcock Center. They have developed some demonstrations of how the air sensors work and how you can build the DIY air cleaner with a box fan and a MERV 13 filter you get from the hardware store. So this is an inexpensive air cleaner as opposed to buying the ones that are super expensive and have their specialized little filter. This is a way for more people to get those air cleaners that work pretty well, according to the EPA, and they can get those in the home. So we have some really cool demonstrations. We have videos of those. We have kits to show you the demonstration. And Billy's team also did a how do you build an air filter? What are the best? So what do different materials mean for filtering air? So we've got some really cool stuff going on with the Hitchcock Center that we're excited about, and we'd love to go and do a demonstration at any place that wants to welcome us to them. And then, of course, we want to get to the root causes, which is how do we advocate for solutions to improve air quality and reduce extreme heat. We've worked a lot in Springfield and Holyoke with Regreen Springfield, the city of Springfield, and the city of Holyoke with their tree planting initiatives. And so we look at that as one key way, and looking at climate resilience issues overall. In addition, we're going to be really focusing on public transit and transportation issues. Next slide. So here are the next steps. So here's where we're going. We're expanding the network. So Hitchcock Center will be expanding in the upper Connecticut River Valley. And then we are working with Health Resources in Action, the Massachusetts Asthma Action Partnership, and they're expanding more in Eastern Mass, working with the Groundwork Trusts in Lawrence, Somerville, and South Coast. Hitchcock will be leading some youth engagement and community action, and we'll be working on public communications materials. The other thing we're doing is we're about to open a new, to launch a new version of the website. And we are going to be developing an app. So next slide. Next slide. Okay, this is about that. So anyway, let me just tell you about the app. This is about how you can, nope, I guess we don't have that slide here. Anyway, there are two things happening with the app. We got funding with the support of Senator Markey and Senator Warren for a grant from NOAA to build the new website and to do an app version of our Healthy Air Network. That's going to be happening, and through that we will have some funding to get some new sensors. So if indeed, now most of that is supposed to be focused on more on Hampden County, but if you're somewhere else, let us know. We can see if we can get some Purple Air sensors. We'll be adding more to that network. So if you're interested and want more sensors, let me know. And then as part of that, we're also going to be doing some focus groups about how do we build the app. It's going to be working mostly with our Hampden County Resident Advisory Board, but if anybody else is interested in being part of that, again, please let us know. So now this is about what do you do if you already have those sensors. So here are some, we want the sensors go first to Yale. So Yale calibrates them. You saw how Dr. Don Gao was at the EPA site, putting up all of these little sensors to have them co-located with the reference monitor. So that has to happen first. That can take, up to a month to get it back and forth. And then when there are some key things around installing the sensor, it's got to be, you got to have that electricity outside. That can be a challenge. You have to have a good Wi-Fi signal. Some of these, like we found challenges if you have like a captive portal or if you have like a really secure network, that's going to be a challenge because if the Wi-Fi goes down, it can't automatically reconnect, right? And then there's some other key pieces that you need to know around where to do them. And depending on where you are, if you are in the Upper Valley, you go with Billy. If you are in Hampden County, it comes to Francesca and myself to support the installation of the sensor. So we're happy to get out there and help you make that happen. And then once the sensors get connected, then Yale puts them on the Purple Air map as well as on our Healthy Air map. Okay, and let's see. So anyway, I guess that's it. There is all our contact information. I think in the chat that Phoebe has put in all the information about what do you do if you have your sensors, you want to do that, and just the general installation guide that has all of that information in it about where to put it and what to be considering.
Thank you. We do not have any other questions in the chat, but if people have any, you are welcome to put them in there. And if not, everybody will be getting a copy of the slides and we will put the recording on YouTube and send you the link. And you do have a question, which is this also available in Berkshire County?
Sure. So yes, we'd love to work in Berkshire County. So please check in.
Great. Thanks. And so maybe also just to clarify, so folks who are in the Northern Valley should relate to Billy around this. Southern Valley relate to you. Central and or the gateway cities that you mentioned and Boston.
I think everywhere else come connect with us.
Everywhere else.
Unless you're in,
okay.
If you're in Eastern Mass, we'll connect you up with Jerry Medina, who is with and Destiny Gonzalez from Health Resources in Action. So if you know that you're in that area, that it's Billy, go with Billy. Otherwise, send it to me and Francesca.
And I think another question that came up in a meeting I was at earlier this week was, will health departments, who are sort of the focus of this particular workshop, thanks to the co-sponsoring with the Western Mass Public Health Association, will there be a section on your website where we at local health departments can download information or just follow a link to the CDC, about what to tell people about outdoor activity or childcare, whether, when we get calls from constituents saying, I'm worried about whether I should let the preschool kids out today.
Actually, we are, as we upgrade the website, that's one of the things we're including in this is the CDC is like different links to different resources.
Great.
And that is one of the links I think that I was, that I put into the new draft.
Great.
So, I would be, and I think that one of the things I would say is that if anybody has any suggestions or thoughts, as you look at, we're going to be, doing a soft launch of this new website, hopefully in the next couple of weeks. We've gotten a lot of feedback from our resident advisors and from our key partners. Now we're going to be looking for feedback from all of you. And I think if there's anyone who'd like to join our groups and our design team or work with us on this and be really, on the ground with us, we'd love to have you. And again, please contact me. And if the Western Mass Public Health Association wants to be a partner with us, we would certainly love that. We are creating pages on the website for our partners so that they can say what it is that they're doing and how they're using the website. So if they're, if that would fit, we're really open to making this as collaborative as possible and to be as useful as possible to communities.
Well, thank you so much. That's a great offer. And yes, I think having a couple local public health folks look at the website too and think about how it would be. And, Ryan just put his email in there, so I feel like he volunteered.
We love Ryan.
Yeah.
Yeah, that would be great.
Yeah, no, I'd love to participate.
Great.
One thing I would just say about this question about local health departments is I feel like there's really good guidance for individuals from the CDC, for example, but I feel like it gets a little more nuanced when you're talking about like institutional recommendations, like what do you tell a school or a summer camp? Like, I know like we have to sort of figure out, like in our own summer camp is, okay, like given the nature of who's in a particular group and the age of the kids and so on, and the value of being outdoors, how do we balance out the public health recommendations related to air quality with these other factors? And so, like, obviously, if the air quality is in the red, no one's outside. But there's a lot of gray area there, I think. And
sure, I was more just thinking you folks are doing you can at least send us to the right places.
Yeah. No,
Yes.
I just think it'd be great to get some guidance from public health folks, like how do you guys think about this sort of thing? Because telling people to stay inside all day is not necessarily always the right answer.
No.
And we want to mitigate people's exposure. And in some cases the answer is like close the windows and turn on an air cleaner, whether it's when you have or when you build.
Right. Well, I'm going to say thank you very much to all of you and stop the recording. I assume if people want to stick around and ask you questions, they can. And otherwise, I just want to say thank you to everybody who came and who took the time out of already pretty insanely busy local public health lives to apply for the DEP grant and now to send their sensors to Yale and work with Billy and Sarita and everyone. So I'm excited that we're expanding this capacity all around Western Mass. And thank you all. Thank you, Sarita and Ryan and Billy, for being here today.